Hi, my name's Nathan, and this is part two of my conversation with Vishal regarding mental health. We're going to be talking about how it was felt for me to support Vish and how it was being on the other side of someone suffering with mental health. So, like and share this video. I'm sure you're going to get lots of insights into what it feels like to support someone with mental health.
Hello and welcome back to part two of the conversation with me, Vishal, and Nathan about mental health. Especially considering it's Mental Health Awareness Week and Month, it's an ideal time to do this conversation. I'm Vishal, award-winning author, international speaker, publisher, entrepreneur, and 6-time severe mental health conqueror. And this is my amazing best friend, Nathan. Nathan, do you want to give a very quick intro so that you can tell our viewers and listeners about you?
Yeah, well, in terms of our relationship, I've been friends with Vish for the past, say, 20 years. And throughout that time, we went college together. I was really into basketball at the time. And then, just basically our relationship just grew from there. And we've been on countless kind of journeys and adventures together. Myself at the minute, I'm in full-time work and I'm raising a family as well in these modern times. So it can be a struggle even without the mental health aspect. Anyway.
And 20 years on, here we are.
Yeah. Still having great times.
Yes, absolutely. This interview and conversation is about what is it like for someone who is supporting someone else with severe mental health challenges.
Mm-hmm.
So getting an outside perspective on what's going on and how to support that person. So what was it like for you, Nathan, seeing me go through now 6 severe episodes of mental health? How was it for you?
Yeah, I mean, I'd just start by saying that for anyone watching, like, who knows and has been through this themselves, or they know someone who's been through it, each time is so different. So even though you count it as 6, it feels like a new experience is happening again. It's a bit like going on holiday. Just because you've been on holiday, you still don't know what to expect the next time you go somewhere. So I feel like it's difficult for myself because it's hard to relate. And it's hard to comprehend that your friend is going through something that you see on TV, for example. Like, the whole kind of trend of today is like depression, anxiety, mental health. But I genuinely feel like for people not going through it, they have a difficult time still understanding it. They might hear it in the headlines, but they don't always understand what's going on. And to my own friend, I was like, wow, is this really happening? Like, it's not happening to me as well, so it feels a bit surreal. But obviously I knew at a certain point, it's almost like, if I say it in a way to describe things, how they feel for someone supporting is like, it's hard to put yourself in your shoes. And you kind of realize when you see that you don't recognize the behavior in that person being yourself, you don't recognize them almost anymore because you're like, this is not, they're out of character, basically.
And if you're wondering what kind of challenges he's talking about, if you watch part 1 of this interview, you'll get a very clear idea of what I was struggling and suffering with. That's a great point that you just mentioned, Nathan. And what were some of the signs and symptoms that you noticed about me that made you know, okay, here we go again?
For me, I think if I meet you face to face, it was realizing that you maybe couldn't concentrate. You couldn't concentrate on either the conversation, or if we were doing something like going to the cinema or going out for food, you wasn't in the moment. You could just feel that there was a bit of a distance between what was happening and maybe what was going on in your mind. But because Vish is so open, I kind of got an inkling from you yourself that you was going through stuff, for you to say, I'm not feeling myself again. I'm not sure what's happening, but I know I'm not sleeping right. I know I'm not feeling right in myself. So I got it firsthand from you, but when I know you're going through an episode, I just don't really, things are out of character, like I say, and it's just like the concentration aspect. Like, I don't know if you're always there in the room. You're with me physically if we're going out and doing something, but yeah, mentally, I'm not sure if you're there, kind of thing.
Okay, so you noticed I wasn't concentrating, I wasn't very present, I was elsewhere, even though I was physically with you, I was elsewhere. And you could just tell.
Sleep and that as well.
Yeah, you could tell that I wasn't sleeping well, you could tell that I wasn't myself.
Mm-hmm.
Okay, very interesting. And what things did you do to help me with my mental health? And what can someone else do to help someone else with mental health challenges?
Yeah, I think obviously you've had a number of episodes. So I think from the first few times that you've been in a crisis, unfortunately, it was that route of you being sectioned. So it was almost like that the professionals took control because they chose to intervene and guide your family and myself through what's going to happen. Then I think this time round, because you went ahead and made yourself an inpatient voluntarily, then it made it easier for us to understand that, okay, Vish needs help. Last time, it was all about communicating with you. So you set up a group, which was fantastic again, that we could communicate with your auntie and your sister and a relative who's a doctor as well. And that just meant that we had that first port of call with you. If anything was changing during the day or the night, you could contact that group, and if we weren't all available, one or two of us would reply to you as soon as we could. So yeah, communicating with you was really vital, like to show that support, to show that we're there. Again, Vish is so proactive, it's hard to help him, like, because he wants to overcome it himself, but because he was willing to offer that support, I just wanted to let him know I was there whenever he needed me, yeah.
Okay, very interesting. So what was the journey like? Because 7 years ago, I was sectioned, and sectioned means that you're involuntarily, without your choice, you're put into mental health hospitals. And when you voluntarily go in, you've decided to put yourself in that environment. So it's a big difference between the two. What was the whole journey like? Because it wasn't just, oh, I showed up and I'm in a mental health hospital.
Yeah.
From your perspective, what was going on? How was the journey?
The first time?
Yeah, compared to this time.
I feel like I say, it was less immediate with you like voluntarily going in, but also probably knowing that you're quite frustrated about, I know you would have felt this, and it's important, I think people hear that you feel you don't want to rely on people and you don't want to be a burden on people. Like, I just feel, not just Vish, I mean people suffering mental health, like they feel like they don't want to bother people with their issues. And you being so open, I felt that meant that we could be there for you and we could try and guide you with our opinions and our thoughts as you divulged what you was going through. So for example, you're trying walking a lot to be in the present moment, and we might suggest, okay, do it, but only on a good day or when you're feeling right. If you're actually physically tired and shattered, don't do it. So we just offered you, I guess it was offering you alternative perspectives, because as well, Vish explained this in the first video, every interaction, be it even the TV or the people you know and love, there's a little bit of like paranoia of like, are they really who they are? And have they got my best interests? So we're always aware of that. I'm trying to be consistent with my points of view. Like, yeah, it's good you're getting help. It's good you're trying these therapies, and just encouraging you basically, because you always had that little bit of doubt of what the professional's doing and what your family are doing. Reassurance.
I loved how impromptu this interview and conversation. This is brilliant.
Yeah.
Were there times where you would have private conversations with family members and other people where I wasn't involved? And how did that go, if it was the case?
More so the first time that you went in and you were sectioned, but as you've had these other episodes, we feel to speak to you more directly. You know, initially when you've been sectioned and you've gone in against your will, obviously we're talking because you're kind of there in that moment in the mental health hospital, and we're on the outside. And we're also trying to support each other to say, I want to reassure your family, you're going to be okay, like you're going to get better, and they just want you back, do you know what I mean, back to the normal Vish. So I think, yeah, this time it was a lot easier to kind of be there and just talk to you directly. The odd conversation, just to check that we're on the same wavelength with your auntie and your sister and your mum and dad, to just say, do you agree if I say this to Vish? Do you agree that's a good idea? Not to say that you can't make that decision, but just to check that what you're saying is correct.
Yeah, because at the time I wasn't making rational decisions or logical decisions.
Yeah, so that was good, just to have that reassuring kind of interaction away from the group, to just talk to each other and support each other. Because like you're saying, we're having this part 2 of what it's like for me to support you. That's what it felt like. Like I needed a bit of support as well as you. And I think, as well, your family felt that way, that they would need support, because it's difficult, yeah. And it's hard to say that to you. So that's why you have them conversations away, because you don't want to tell the person that's going through it that it's difficult for you, because they've already got so much to deal with. And they know that they don't want to bother you or burden you. But you don't ever feel like that. You know, you're my best friend, and, you know, for your family, you're a son and a brother, like, and a nephew. They don't feel like that at all, but they just need some support themselves, because you get kind of to the end of you exhaust your kind of options of what do I say next? How do I help out more? And you don't always need to help. You mentioned in the first one, just being there is enough. You know, if you say, anytime you need to text or call me, I'm here, that was probably enough.
So the first time I was on one of the episodes, the first time I was admitted into hospital against my will, you were all talking a bit more about what was going on, and in a bit more communication without me knowing.
Yes.
But this time round, because I voluntarily decided to go in, it was more direct. You were communicating more directly with what was going on.
Yeah, we just kept you in the loop. Because we know that paranoia is not supported if you think, well, how did Nathan know that? He must have spoke to my auntie. Why would we need to do that? Okay. So we just all divulge it in the group. Therefore, I'm hearing it from your auntie as you're hearing it most of the time, unless we were unsure with what we were saying.
Okay.
Yeah.
So what were some of the things that you and my family did practically to support me, so that our viewers and listeners, they can take that away and maybe apply some of those things to the people they're supporting with mental health challenges?
Yeah.
Because we're talking about, there was a pandemic with COVID, but the real pandemic, I think, is mental health, mental health challenges.
Definitely.
So what would you say?
I would say, be there for the person. Let them know that you're there, and actually be there for them. And not just that, don't just let them communicate to you whenever they're feeling bad. Take it upon yourself to regularly contact them randomly throughout the day or the week, just to say, how are you doing today? How are you feeling? Because how I understood it, not knowing going through it, is that if you are in your worst moment, you probably don't want to communicate. Like, you're not motivated to reach out sometimes. So if I can reach out in them moments you're not feeling as great, that is a kind of pick me up in a little way to say, we're here. And not only that, even when you're not asking for help, I just want to see how you're doing. So always reach out to people and keep checking in with them. Yeah, definitely. After that, I would say, for me and you personally, obviously with each individual supporting you within your family, for us personally, it was meeting up regularly, like face to face. Because again, through a text, through a call, you can't always get a grasp of what someone's going through. They can kind of just play along with like, oh, I'm okay. But face to face, you can see how they are. And you mentioned it in the first video, the hygiene part of just getting up, having a shower, doing your teeth, grooming, making your bed, again, if I meet you face to face, I know them things are done. If you just text me, oh yeah, I did that, but you're still lying in your bed, like you can, make it up basically. So again, for anyone out there, it's like get face to face with your relative or your friend or whoever it is that's going through it, because I think there's nothing better than that human connection. And Vish spoke about COVID. We all suffered from that. So in a crisis, you definitely need that human touch, as they say, of like being there face to face. And it got you out as well. It's like a double, it helps you out in two ways.
So the two things you said is reaching out regularly,
Yes.
keeping regular communication. And the second one is, especially if you can, meet up with a person in person.
Yes.
So that you can get a real feel of what's going on.
Yeah.
Is there anything else that
On
you
top of
do?
that, I think encourage, again, for Vish, it wasn't so hard in this particular time because you self-admitted yourself. But I'd say on them first times, it would have been for us being of more clear, focused mind of your family and friends, to encourage you to seek that help sooner. And I think we've always encouraged that aspect of the medication as well and the professional help. Just because it's one avenue, you were always doing things yourself with the therapy, with the exercise, socializing. You were always doing your bit, going for walks, being present. You tried so many things, but at the end of the day, sometimes you just need that angle on top of it, because I feel when I've seen you go through these episodes, it's not one thing and it's not one moment that makes you better. It's like a number of different approaches and angles, and depends how the recovery is going. Do you know what I mean? That actually brings you out of it. It's a gradual thing, and every time is different. So yeah, be patient. Be patient with your relative, with your friend, to know that it might be a bit of a journey. But like I say, encourage them to have that professional help. Encourage them to take the medication if that's what they've decided with their doctor, with their healthcare professional anyway. And I know your family were involved, obviously, in actually going to them meetings. So for myself, because you had that family support, it wasn't necessary for me to be there. But I'd say if you knew a friend that had relatives abroad or not in a different city, maybe I could have accompanied you to them if that's what you wanted. You know what I mean? It depends, again, what the individual wants.
And the other thing that I think you did really well was I asked you if you would come and see me once a week, and you made an effort almost every single week whilst I was in hospital to come and see me.
Yeah.
And you even brought Blake along, your little son.
Yeah.
My nephew. He's called
Yeah.
Uncle Vish, yeah. Yeah, I brought him along.
Yeah. And I think that was nice because it's normality. Like, I'm going to meet you with my son anyway, just because you're going through a crisis. Again, there's this stigma with mental health that what is Vish going to do? Is he going to run into the road? Is he going to hit someone? Like, no, that's not what's going on. Just because you lose your focus and you feel outside of yourself, it doesn't necessarily mean anything bad is going to happen. Like, it's a lot of it is internal, I feel. So, just treat it as it was a normal get together. My son's here, we're going out, we're going to get food, or we're going for a walk. Like, let's do what we would normally do.
So you worked in the ambulance at one point. You were part of the ambulance service, and you saw so many people go through different kind of challenges, and mental health was one of the big ones.
Yes.
You saw me go through severe mental health challenges, and there was a process to it, in the sense that you were going to people's homes who were in a crisis or had been through a mental health challenge. From an outside perspective, what were the steps that you saw me take to get to a point of being hospitalized? Do you remember all the steps?
I feel like there's an element of you that is just, you're almost becoming like burnt out and frustrated. Like, do you know what I mean? Like, I can see it physically and mentally that you're just getting to the end of your, say motivation to actually lift yourself up. Do you know what I mean? So I feel like that was feeling burnt out. Your insomnia was a major one. And then not being able to do your day-to-day things. Do you know what I mean? Like your responsibilities, your business, attending family events. You know, especially for you going abroad and doing your events, I felt like you were quite isolated. Do you know what I mean? So being around people, I felt that that was very important. So the fact that you wanted to be around us this time round was good. You probably didn't feel like being around us, but you made the effort as well. So it was mutual. You know, I came to see you, but you wanted to be seen. You didn't close yourself in and isolate yourself. And I think that that's a recipe for disaster, because you're just in your own thoughts then, and they're going to spiral out of control. So yeah, I think after that, it was just, there was so much acceptance with you this time. It was different. Yeah, I feel like you just, with going in yourself and choosing to be admitted rather than sectioned, it probably made it a little bit less stressful for all of us. Do you know what I mean? Which was nice, because we knew you'd accepted the help. You accepted the help yourself, so you didn't feel you was being held against your will. You know what I mean? It was a decision. It was a decision. I feel that's important. And even when we conversate with you, as someone supporting you, just give your opinion, give your advice, but let that person be in control of their own decision. Do you know what I mean? Let you say what you want to do. I can only offer my opinion, but at the end of the day, you know how you feel inside. So yeah, be gentle with the person. Yeah.
Okay. Good. I've got one last question for you.
Yeah.
Before I ask that question, I really think that it'd be worthwhile you doing an interview with a mental health expert, a psychiatrist, maybe a psychotherapist, or someone like that, some sort of therapist, to get a professional's point of view, because they've experienced and been through so many cases of people struggling with mental health challenges. And I think that would help a lot of people. And if you agree with that, leave a comment below so that we can start reaching out to more of these professionals. Nathan can start reaching out to them.
Yeah, definitely.
So my last question to you is, to make it really practical, for someone who's helping someone with severe mental health challenges or any kind of mental health challenges, what are a few tips or a few pieces of advice or some words of wisdom that you would give to them?
Yeah. The first bit of advice is listen. Listen to your friend or relative or whoever's going through it. Just listen to what they have to say. Because, again, I feel with mental health, your brain is at a point where it's struggling to process normal, everyday things. And for you to just listen to them, they're getting it off their chest, and maybe by them speaking it out, they understand what they're feeling and what they're going through. Because to say you're down or to say you're having a psychosis, that's not easy. Even for me to say that, is not easy. So for you to say it out into the world and face to face to someone, it's a step. It probably doesn't feel like it. It's like we spoke about the hygiene thing. Just getting out of bed is a step, and just start small and build it up. So mine was, like I say, letting him speak, then maybe offering my advice and my opinion, but also asking questions like, what do you think should happen next? What do you think you should do with how you're feeling? And they can kind of rationalize then what next step to take. So definitely offering the ear. Being there, like I said, physically, offering your advice and opinions, and also speaking to the group, your family, about where they think it should go. So having that extra communication, because they're offering you support as well. So seeking support yourself as a supporter of the person. And finally, I would say a big journey for me, which was separate to probably being around Vish, was looking into it myself. You know, even if it's just Googling it, even I looked at books as well that were other people's accounts of mental health, and even, you know, other YouTube videos to see other experiences, to know what these terms are of being sectioned, psychosis, you know, the medications that you take, the side effects, you know. So again, working in the ambulance service, I knew the route that people should take, but again, we don't want to be looking to force people to do something. They're just recognizing that they're in a crisis. We want to guide them. So definitely the last one would be to guide them and support them through it.
Okay, so the first one was listening.
Yes, listening.
The second one
being
was
there physically.
being there physically.
Yeah.
Third one, offering
Your
advice
and
opinions.
opinion. Yeah.
And the fourth one
is seeing which direction you want to go. So through that conversation, seeing what direction. But for yourself, the last one was getting more information yourself, learning more about that condition that your friend or relative is going through. So learning, basically.
Love that.
Yeah.
Love that. Thank you so much, Nathan.
Yeah, nice one, Vish. Nice one.
I hope this helped you. And remember, if you got something valuable, feel free to leave a comment below. And definitely share this with someone you know who's helping someone else with mental health challenges. Thank you for your time.